Hello, fellow congressmen. My name is Shafanda Grimsley, and today I would like to talk to you about a healthcare issue that is present in my community in North Carolina. What we have going on here is the Affordable Health Care Act and how it pertains to the minority community and making sure that everybody is able to afford medical treatment. With that being said, this health issue affects not only minority communities, but it also affects the elderly population as well. The impact of this health issue on the community is that due to the fact that many people are not able to afford health insurance, health coverage, medical or dental treatment, they simply go unseen or untreated by a medical health care professional. The issues that we need to address here is making sure that our community is performing at its healthiest and at its best. Minority communities and individuals such as African Americans, Mexican Americans, Latin Americans, and low income households are able to access medical needs, supplies, and instruments, treatment, and prescriptions that they need to have the healthiest life. The proposed policy would be a policy that is already in existence. However, I would propose that we alter some of the policies, qualifying credentials so that more individuals in these communities can have access to these services. In addition to having access to the services should also become available for those people who need them in the communities that they need the services in. The proposed health policy that is in deliberation here is not only the Affordable Health Care Act, but we will also contemplate looking at Medicaid and Medicare as well, because these are programs and policies that are already in place to supplement some of the cost of medical expenses for the minority population. The change that the policies need to undergo would be reducing some of the stipulations that it has on qualifying candidates. For example, certain income requirements would be altered and allowing for more people to meet those qualifications or fall in the brackets of qualifying. And now, also within the medical field, we want to make sure that our patients feel comfortable with coming to us for treatment. So we definitely don't want to pass any type of immoral judgment on parties receiving treatment paid for or in the budget of Medicaid or the Affordable Health Care Act or any of those programs or services. We want to be giving these individuals the best treatment to ensure that they have success in their life with their health issues, whether it be obesity, diabetes, blindness, arthritis, whatever variety of health issues that are presented within the community. We will have access to these services in the medical facilities that are ran and operated by proprietors who accept the insurance that the individuals carry in the community. I find that oftentimes people do not seek medical treatment for the reason of no health insurance or lack of funds to pay the bill, and simply don't go and get the help that they need because they fear of the medical bill and expense is overwhelming to low income households and people who are in minority communities who don't have the access and resources to see these healthcare specialists like cardiologists and endocrinologists and neurologists to maintain a stable life with healthy numbers and levels in their body, and having to change the qualifications for meeting the policies benefits budget would definitely need to happen in order to get more individuals in the community seen by the doctor. Um, so that more people in the community are healthy. The thing that we would have to consider when we are treating individuals with third party funding, we have to consider the cost benefits and risk of the policy. And some of the cost benefits would be to the individuals in the communities who would receive these services. They will have minimum to no or low cost for the services rendered and the treatment that they need to have, because it's ongoing. And in order to maintain a long life, you would need long-term treatment for these medical health conditions that last for a lifetime or for a person's lifetime. So making sure that they're able to get treatment that is affordable to them by having affordable copays as well as premiums for children, adults, and seniors, so that everyone can qualify and seek the medical treatment that they need at that particular point in their life. Some of the risks that I think about would be, since the funding is coming from our government, we would have to take in account the cost of taxes being inflated for the upcoming years to compensate for that, or budgets would have to be rearranged in order for the necessary medical policies to be put in place for the target of population of treatment. And the lives that are affected by this health issue can definitely be changed for the better, in the sense of if more people are getting treatment, health care, follow ups, monitoring their prescriptions, making sure they're on the right dosage, that kind of continuous follow up, then I feel like it would create a longer life expectancy for those communities and populations, based upon much research with preventative methods. A lot of education can be given to prevent some of the backhand medical expense costs, so that if you know about being safe, it would be more cost effective to teach people to be safe or cautionary, or how to prevent an illness or disease from occurring than to treat it. And by sharing that knowledge with the community, it would definitely be a positive effect on the community. The most important thing that I want you guys to take away from this today is the lives of the people who are affected by this policy will forever be changed, because we're not only looking at the money that it costs to see the doctor, but the individual, and meeting them where they are so that they can receive the medical treatment that they need in a timely fashion and in an affordable manner, so they don't have to become overwhelmed with stress from not being able to make medical bill payment. Increasing coverage and lowering healthcare premiums, as well as having a bigger open enrollment, will create a better, healthier North Carolina. It will give us all a life lesson to teach our children, and that's how to live a healthier life and be the best selves that we can be. We encourage each other to go to the doctor to stay healthy, but if you can't afford it, you cannot go. This is a crisis that many people face, and they live at home and suffer in torment and pain and agony because they cannot afford health insurance. So today I ask, when you make your vote, that you consider those individuals. No one should have to suffer and live in pain, and we all should be able to be treated by a healthcare professional with medical illnesses. Thank you so much. Vote for healthcare reform. Thank you for your time.